Welcome. I am Dr. Thomas Gerber, one of the associate editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our editor-in-chief, Dr. William Lanier, has picked as editor's choice and highlights for the December 2013 edition of our journal. But first, let me tell you that beginning in January of 2014, our website will offer two new exciting features. The interactive Path to Patient, which is curated by my associate editor colleague Dr. Lori Erickson from the Department of Laboratory Medicine and Pathology. Each month, Path to Patient will present a pathology image, micrograph, or gross specimen, a brief quiz to test your knowledge with immediate feedback on how you did, and background information on the condition at hand. You will get to see stunning images in this new section. And it was in 1864 that Dr. William Worrell Mayo opened a practice in Rochester, Minnesota. To help celebrate 150 years of patient-centered care at Mayo Clinic, we will have another new online-only feature. Each month, this feature will present a historical Mayo figure that played an important role in the development of our journal, or historic Mayo Clinic Proceedings articles that described groundbreaking discoveries. There is so much interesting material in this month's issue, and a couple of main themes that are explored from fascinating different perspectives that I honestly hardly know where to start. This month's editor's choice is the original article, Physician Satisfaction and Burnout at Different Career Stages, by Dr. Liselott Derby from Mayo Clinic in Rochester, Minnesota, and colleagues from Mayo Clinic and the American Medical Association. Based on their cross-sectional study that involved a large sample of U.S. physicians from all specialty disciplines, the authors find that burnout, satisfaction, and other professional challenges for physicians vary by career stage. Middle career appears to be a particularly challenging time for physicians. The authors recommend that efforts to promote career satisfaction, reduce burnout, and facilitate retention need to be expanded beyond the typical early career interventions and may need to be tailored by career stage. The accompanying editorial, Medicine and Its Discontents, by Dr. Glenn Gebert from Baylor College of Medicine in Houston, Texas, also addresses a commentary entitled The Phantom Limb of the Triple Aim by Dr. William Spinelli from Allina Health in Minneapolis, Minnesota. Dr. Gebert suggests that we examine ways to streamline administrative work for physicians, decrease their paperwork, restore a sense of participation in decision-making, and encourage attention to wellness. One of this month's featured highlights is the original article, Maternal Inactivity, 45-Year Trends in Mothers' Use of Time, by Dr. Edward Archer from the University of South Carolina in Columbia, South Carolina, and colleagues from several other national healthcare institutions. The results of their examination of trends in time use and physical activity energy expenditure in a nationally representative sample of U.S. mothers suggests that maternal inactivity may be an important target for the primary prevention of chronic, non-communicable diseases and obesity. The accompanying editorial, Optimizing the Health of Mothers, Infants, and Communities Through Research, by Drs. Thomas Kotke and Patrick Cornea from Health Partners in Minneapolis, Minnesota, also addresses two other original articles. Maternal vitamin D supplementation to improve the vitamin D status of breastfed infants, a randomized controlled trial, by Dr. Sarah Oberhelman from Mayo Clinic in Rochester, Minnesota, and colleagues from several national and international healthcare institutions, and Supervised Exercise-Based Intervention to Prevent Excessive Gestational Weight Gain, a randomized controlled trial, by Dr. Jonathan Ruiz from the University of Granada in Granada, Spain, and other Spanish healthcare institutions. Summarizing the information in these three articles, the editorialists point out that international experience has revealed that there are many opportunities to optimize the health of mothers, infants, and communities that lie beyond healthcare. Hence, America needs initiatives that reach far beyond mother-specific, clinic-based interventions to take full advantage of its human capital potential. The two other featured highlights in this month's issue are the original articles, Characteristics and Outcomes of Patients Who Achieve High Workload, more than 10 metabolic equivalents, at the time of treadmill exercise echocardiography, by Dr. Noel Fine and colleagues from Mayo Clinic in Rochester, Minnesota, and Use of Functional Aerobic Capacity Based on Stress Testing for Predicting Outcomes in Obese Patients, by Dr. Muaz Abudiab from Mayo Clinic in Scottsdale, Arizona, and colleagues from the Rochester, Minnesota campus of Mayo Clinic. The accompanying editorial, Physical Activity and Cardiovascular Risk, 10 Mets or Bust, by Drs. Jill Barnes and Michael Joyner from Mayo Clinic in Rochester, Minnesota, also addresses two additional original articles and one review article on a similar theme. First, validation of a novel protocol for calculating estimated energy requirements and average daily physical activity ratio for the U.S. population, 2005 to 2006, by Dr. Edward Archer and colleagues from the University of South Carolina in Columbia, South Carolina. Second, protective role of resting heart rate on all-cause and cardiovascular disease mortality, authored by Dr. Arpit Saxena, also from the University of South Carolina, along with colleagues from other national healthcare institutions. And finally, Physical Activity Promotion in the Healthcare System by Dr. Ilkka Vuori from Tampere, Finland, with co-authors Dr. Carl Levy from the Oxner Clinical School and Dr. Stephen Blair from the University of South Carolina. The editorialists deftly summarize how the evidence and useful recommendations in these 5 articles on cardiovascular health can help with the struggle of the medical community to systematically promote physical activity and exercise as a means for reducing the risk of cardiovascular disease. This month's contribution to our ongoing Symposium on Regenerative Medicine, entitled Regenerative Nanomedicine for Vision Restoration, was authored by Dr. Marcus Zarbin from the New Jersey Medical School in Newark, New Jersey, and colleagues from several other national healthcare institutions. This symposium article and a concise review entitled Human Immunodeficiency Virus, What Primary Care Clinicians Need to Know, are also listed on our cover page, and they provide the 2 teaching exercises in our December issue, for which you can receive up to 1 hour of CME credit if you complete the appropriate documentation. Video interviews are available with authors of most of the articles mentioned in this recording and some others as well. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Also on our website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. Samuel Asivatham, a cardiologist with a subspecialty interest in electrophysiology from Mayo Clinic in Rochester, Minnesota, who serves as a member at large. And just to remind you, you can find on our homepage a number of online-only features that are not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, art at Mayo Clinic, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and the other outstanding articles in the December 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the next issue of Mayo Clinic Proceedings, which will go live on our website on January 2, 2014, will contain articles entitled Systematic Analysis Underlying the Quality of the Scientific Evidence and Conflicts of Interest in Interventional Medicine Subspecialty Guidelines, Preemptive Genotyping for Personalized Medicine, Design of the Right Drug, Right Dose, Right Time, Using Genomic Data to Individualize Treatment Protocols, and Increasing Incidence of Melanoma Among Middle-Aged Adults, an epidemiologic study in Olmsted County, Minnesota. In the meantime, you can watch videos related to our journal content on our YouTube channel. You can also follow us on Twitter and like us on Facebook to stay up to date on online first publications and on breaking news related to our journal. Direct links to our YouTube, Facebook, and Twitter presences can be found in the upper right-hand corner of our homepage. See you again next year.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.